So as the 988 administrator for the state of Ohio, I'm going to talk with you today just about what 988 is, which if you're watching this, you probably already know what that is, but we're going to start with just a couple of foundational pieces about 988. We always like to start there because we want to level set for all people as to what 988 is, maybe what it is not, help to just paint that picture, make it clear, raise awareness. We're also going to be sharing updates today, and we're really excited about over 3 years of providing 988 services in Ohio through the easy to remember 3-digit number. So we'll be providing those updates to you. We'll leave some time at the end for questions and answers as well. Pretty conversational, so if you have a question and you can insert it into the chat and it's the right time to answer that question, then we'll answer it during the presentation as well. So I am going to share my screen, so give me just a minute for a few clicks, and we will be off and running. Okay, Evie or Emily, if I can get an audio check just to make sure you can still hear me and see it.
Fantastic. Yep, all looks good.
Fantastic. So I do want to just start, as I said, kind of with the foundation of 988, because there is still much question about 988, especially around it being a line for suicide only, for suicide prevention or somebody thinking about suicide. And it is far beyond that. The mental health crisis that a person may be experiencing is defined by the person who's contacting 988. Never has anybody contacted 988 and we say, well, that's not really a mental health crisis, goodbye, and hang up. Of course, if it is a mental health crisis to the person, then it's a mental health crisis to us, and we're going to help that person just find the way through that to hopefully become safe, to see the light at the end of the tunnel, to really see hope in their life. So I like to talk about with all audiences just mental health risk factors, because sometimes people think of mental health and they think of a group of people that's not themselves, like somebody over there with a diagnosis of a mental health condition. But when we look at risk factors, nobody plans a mental health crisis. They don't wake up and say, well, today's a good day for a mental health crisis, nor do they plan a heart attack where they might call 911. Just like physical health, mental health can be completely unexpected. When it does come up, it can come through a series of events or a single event. It can come through things adding on top of each other over time. It can come from conditions of mental health. So when we look at this list, what we see on this list are things that any person in the general population could experience. It might be mental illness, but it might also just come from something like declining function. If we all live long enough, we're probably going to experience some amount of declining function. Social isolation, we went through years of that with COVID. Family problems or loss, we experience that both with people who are close to us as well as in other contexts like national contexts. And those losses can be, of course, unexpected and can throw us into a place of being in a crisis. So what we want people to realize is that mental health crisis and suicide risk factors are common to all people. So we want to eliminate that there's a stigma associated with mental health. We want to eliminate that it's only a mental health crisis if you're thinking about suicide. We want people to have health in mental health regardless of what the circumstance is. So 988, just a little bit of history here, kind of how long it's been around and how it formed. 988 allows a help seeker, somebody experiencing a crisis, to talk to a specialist who can help with, of course, the mental health crisis and thoughts of suicide. We started by talking about that, but any other problems with substance use or any other types of emotional distress. But the 3-digit number is also very useful to what we would call a third party, or somebody contacting 988 on behalf of somebody they know who is experiencing or possibly experiencing a crisis. So what that might look like is a parent and their child is experiencing a mental health crisis. It might be a spouse and their spouse is experiencing symptoms of a mental health crisis. It might be a teacher calling on behalf of a student, or somebody that you are friends with, calling on behalf of that friend. So it offers help to both the first person who might be in crisis or the third person who might be calling on behalf of that person in crisis. But being a 3-digit number, there is such power in that. When you're asked what the old National Suicide Prevention Lifeline telephone number was that 988 replaced, most people, even those in the mental health field, probably don't remember that number because it was a 1-800 number, it was long. They just don't remember it. 988, very easy to remember. And the other very important piece of that is the number remains the same any place in the United States. So if the person moves away, the number remains the same. If they move into this region, the number is the same. If they're on vacation, the number is the same. So wherever they're at, if they dial 988, they are going to get help. Now, the way that 988 works now is different than when it first launched. When it first launched, it was directed by the help seeker's telephone number to the closest 988 center where that telephone number originated from. That was back in 2022. Things changed in 2023, 2024, where it then became a geo-routed call. Now, that is not precise geolocation like 911 is. So when somebody dials 988, the 988 specialist does not know the exact location of that help seeker. Instead, what they know is that the help seeker is calling from someplace within the general vicinity of that contact center. It uses cell phone towers to direct it to the appropriate location of a contact center. And what that allows is for the help seeker, if additional resources are needed, to be speaking to somebody who's located in a nearby community, who understands local resources, and can help the person in the best way. So the 3-digit telephone number is important. It's also important that people understand that it is confidential, and we've tried to really convey that through explaining the difference between geo-routing and geolocation. We do not ask questions. We don't have identifying information when the person calls. It is a free service to anybody who needs to contact 988. And when I say contact, I mean that the person can not only call, but could also text. Of course, that would be with a texting device, typically a smartphone, could text 988. People say, well, what number do I text to get 988? Well, you send the text to the 3 digits, 988. Very simple to do and start a conversation. If you chose to chat with a 988 specialist, you would go to a web browser. Any device that has a web browser, so smartphones also have that, but so do tablets and computers. So a web browser would go to 988lifeline.org to be able to initiate a chat. So people are most familiar with chats when we think about like online customer service, things like that. It is a chat function that allows you to have a conversation back and forth by using your keyboard and your device to have it similar to text, but through the browser. So it's important just to understand what to expect when you dial 988, because raising awareness of 988 is very important. People have to know that it exists. But another barrier to people using it is knowing what to expect. Because if there's a fear about what to expect, they're going to be less likely to contact 988. So knowing what to expect is an important part that we have in explaining to the community, to the public, what it is that they'll experience when they contact 988. The first thing they're going to experience is actually a press 1 or press 2 option. I know it says press 3 on the screen. We're going to have to update that ourselves. The press 3 option is not available currently because of federal changes that have taken place. Press 1 is for veterans services. Press 2 is for Spanish speaking. So that would get people to a contact center that can best serve those needs if the person chooses to press that. Now, I will say that we actually do have veterans who contact 988, and instead of pressing 1, they just remain on the line because they don't want to talk to a veteran-specific helpline or contact center. They just want to talk to somebody as a human, not as a veteran, that's experiencing a mental health crisis. That is completely acceptable. The press 1 option is a choice, and veterans can choose to press that. Veterans and active military, I should clarify. Can choose to press 1 or not press 1, and either way, they're going to get help. There's going to be just a short music session as the call gets transferred then to the most local call center or the most appropriate call center. And then the person who is answering the 988 line is going to pick up the phone and say hello. It's a human. And it begins that human interaction. And that is really the value of 988 is the interaction with trained specialists who this is what they do. They help people de-escalate a crisis through the interaction with great success. So what we are seeing right now is about 80% of the contacts to 988 can be completely de-escalated through the interactions, through calls, chats, and texts, to where the person who was in crisis feels that they are no longer in crisis at that time. Also, some things to know about 988, what to expect is that at the end of the contact, you're going to get asked, would you like a follow-up call or follow-up contact? Because we want to make sure that the person isn't just okay when the initial conversation ends, but that they remain okay. So part of the service of 988 is a follow-up service. So if the person would like that, we will schedule that time for their convenience and we'll follow up. If they don't want to follow up, that's okay too. We don't force that. Some people say, you know what, thank you for your help. I'm okay. I don't need you to follow back up. That's acceptable. So once they're talking to a person, about 80% of those crises are resolved. What happens to the other 20%? Well, about 18 to 19% of those remaining 20% are helped by getting a local resource. So the local resource might be an immediate response through something like mobile response and stabilization services, that is mobile crisis teams for youth. It might be an adult mobile crisis team. It really depends on what the community has available to that help seeker. But our call specialists, our contact specialists know the resources that are available and will help connect them. It might also just be a referral, providing some information to the help seeker of where they can go or call or contact to get additional supports or ongoing supports or an appointment. And that's important as well. So what happens to the remaining 1 to 2% of contacts? Those are contacts that might require an immediate emergency rescue. An immediate emergency rescue would be police, fire, and or ambulance would be an appropriate response. If the person is at risk of harming themselves or others, is there going to be an emergency response? The answer is yes, and we want people to understand that. It's not because we think that they dialed the wrong number when they dialed 988. They contacted 988 for a reason. They're in a mental health crisis. But let's hypothetically say that the person had the plan and the means to hurt themselves or others. Well, we don't want that to occur for their safety, for other safety. So we are going to intervene with an emergency response. We would work with the 911 centers to dispatch an immediate response and get help out to them. So that is what to expect when you contact 988. Now I'm going to share a video. If all goes well, you're going to hear the audio as well. We filmed this with Ohio 988 specialists. And I want to make that a point because as we wanted to raise not just awareness, but inform people, educate people on what to expect about 988, we had some decisions to make. And one of our decisions was, do we use paid actors, actresses, or do we use actual 988 specialists? Well, to us, because we believe so much in the professionalism and the capabilities of Ohio 988 specialists, it was an easy choice. We said we are going to go with actual 988 specialists to talk about the work that they do because they are so passionate and so capable of doing this work. So what you're about to see is about a 2-minute video of Ohio 988 specialists speaking about what they provide when somebody contacts 988.
When you call 988, the person picking up is going to be a real person who has real life experience and professional training on how to handle your call.
Once you're connected, we'll go through a few safety questions just to assess how you are in the moment and see how you're feeling. And then from there, we'll be able to talk about whatever's on your mind.
You need to talk, you need a resource, you need to yell, get anger out. We're there for all of it. We respect people's confidentiality. People do not need to tell us their name or where they live or where they're at. They're in control of what they share with us.
We're not there to find out your address or something. We're there to find out about you, to explore that with you, to hear your story and what's going on. And together we can come to someplace where you can see the light that you didn't think was still there.
If you ever find yourself in a position where you don't know where to start in your search for support, whether it's for substance abuse or mental health crises, suicide, or even if you're a third-party caller who has concerns about another person, it's just a great place to start and reach out, and you certainly will never be rejected or discounted for calling.
We are not going to judge your crisis. If you say it's a crisis or you feel you're in crisis, then it's a crisis to us. We are here to just provide support and to help you feel like you have the strength to get through what you're going through and equip you with different tools, different coping skills.
One of the last things we say is call us back. If things worsen or if you just need to touch base, we are here.
We're people just like you. We've had our dark days, we've had our good days. One thing we can all relate to is just sometimes you just need somebody to talk to and somebody that will listen.
So when you call, text, or chat, you're going to find someone that is supportive and there for you.
24 hours a day, 7 days a week, every holiday. We believe in what we're doing.
All right, let me advance to the next slide. Hopefully we can make that happen here. There we go.
Doug, we actually got a question that I think actually is a good response to that video. Chris asked, what if the person is lying about their feelings? How do you know when you should go to the scene without confirming they're suicidal?
Yeah, that is a great question. And really, we rely on the experience of the 988 specialist to help navigate through a lot of different circumstances. No two calls, no two contacts are the same. The person has their own freedom to tell the truth or not tell the truth. And of course, that can create problems. It can create many problems on the exact scenario. If the person is or is not safe, they could have a plan and a means to carry out that plan to take their life or harm somebody else, but say that they don't. That would be a lie, and that could put people at risk. But we're going to ask questions that help the person really explain where they're at and what's going on in their lives so that we can help assess with them what could be the appropriate response. So, I mean, unfortunately, we don't have a lie detector built in. We might ask the question if we felt that it was necessary to ask if they're telling the truth, if they're being completely transparent, but it would depend on the conversation, whether it's a call, text, or chat, as to how that could be navigated. I hope that helps to answer, but it's a unique job for sure. It's a unique job skill set to accomplish the job. And just looking at this slide, if I didn't answer the question, please put a clarifying question back in, but I'm going to answer it with this slide here too. Since June of 2022, when 988 launched, Ohio, just going through June of 2025, so 3 years worth of service, was at almost 600,000 contacts. Now, a couple months beyond the 3-year anniversary, we're up to almost 650,000 contacts. Right now, in 2025, we're averaging between 700 and 800 contacts to 988 from Ohioans every single day. So you can imagine the variety of crisis that people are calling in about, the need to be able to understand different people's needs, to be able to walk them through talking about their needs. It is a tremendous task, but we work with every person as a unique individual. So hopefully that helps to answer it. I'll go in and talk a little bit more about this. Please interrupt if there is another question or further on that question that we can go.
Yes. Oh, sorry. They said that this is from personal experience. Diagnostics are huge to me from a collaborative effort with providers. So that was where the question was coming from.
Definitely appreciate that. Yeah, and sometimes the person may or may not tell us that they are receiving any other types of mental health supports, ongoing or in the recent past or in their history. We do ask many questions about that to help the person, give the opportunity to the person to disclose some of that type of helpful information and helping them. But you are correct, working within the other supports that they have and collaborating with those supports is very important. A couple other statistics on the screen. Our speed to answer rate, average speed to answer, is very fast, faster than the national average. The national average is about 34 seconds. It fluctuates month to month, even day to day. Ohio right now in August of 2025, we're at 22 seconds, so even faster than what's reported on this slide. A very fast speed to answer. Now, I walked through the slide of what to expect. Of course, they have to press 1, press 2, or stay on the line, get transferred. That's when the 20-second time or the 22-second average time would be taking place as the call is transferred to the contact center. But Ohio is also answering the demand of Ohioans. What I mean by that is the network, the 988 network, is built out as a national network. Each state is responsible for providing a response to the calls, texts, and chats that are routed from within their state. We have about 0.2%, 0.2% of calls rolling from Ohioans out to national backup centers. So there is a level of support built into the network that keeps the person gaining a response when they need a response. We don't want to wait. We don't want to put them on hold. We want them to get as fast of a response as possible. But for Ohio, 99.8% of contacts are getting answered by an Ohio contact center. That's a phenomenal answer rate. So we like to inform people of that, not just because we're proud of it, but because they are truly getting an Ohio response. This might also help to answer the previous question. Really, we see 988 as part of the entire crisis continuum. And sometimes the person in crisis might only need that first step into the crisis continuum, which is connect. Their crisis might be able to be de-escalated or resolved during the connect portion of providing a service to them. But we also know that people might need more, and we realize that the crisis continuum or the array of services is available. So in Ohio 988 Center, it's very important for them to know the resources that they can dispatch in a response, as well as other resources in the community where they might need to go to stabilize, like a crisis receiving center, an urgent care, other local resources that are available, even other local providers. And then, of course, we see this crisis continuum not just ending after the person is stabilized, but through our state agency, ensuring that providers and that Ohio as a whole is also focused on the Thrive portion. So making sure that appropriate supports in employment and mental health care and medical care and work and all those other things that might support the person in maintaining positive mental health, that those are wrapped around the person as well. So this is where 988 fits into the picture. I won't spend as much time talking about the respond, stabilize, and thrive, but right there in the beginning, as one of the entry points into the crisis continuum, is 988. Another very important conversation to have at a state level and a local level is the difference between 988 and 911. Because both numbers exist for a reason. One did not replace the other. So 988, when it was created, was intended to be able to get the person experiencing a mental health crisis a right response to a mental health crisis. Because what we know is that 911 exists for the ability to get person help through police, fire, or ambulance. So in a mental health crisis, if they were to contact 911, police, fire, or ambulance, it historically was the only option to dispatch to a mental health crisis. Working together with 911, what we're seeing now is the willingness of 911, what's called a public service answering point, or PSAPs, the 911 center, being willing and able to transfer calls, a warm transfer, to a 988 center. We're also seeing that happen in the opposite direction. So a 988 center who answers a contact and realizes that police, fire, and ambulance are a necessary response. Well, we have the ability now to contact the 911 center to have an interaction and get a response out to where the person is at. Now, we are improving and building upon the ability for that to happen. We're building a state centralized system that unifies the two telephone networks, allows for a much quicker and easier transfer, ensures that the caller does not get dropped or placed on hold during that transfer. It'll be the ability to really bi-directional warm transfers between 988 and 911. But why might somebody still call 911 in a mental health crisis? Well, if they are an active threat of harm to themselves or others, again, we do need to get an appropriate and very quick response. If they've already taken substances that are threatening their lives, we want to make sure that there's an appropriate response. But for 988, if they do not have a plan, if they're talking about it, if they're showing signs, 988 could be completely capable of resolving or helping to completely de-escalate that mental health crisis. So both still exist, and we are really working to educate the public that they both exist for a reason and to choose which one is appropriate. What we're starting to see a lot of from first responders and 911 centers, local leaders, is the willingness to sit at the table and talk through this, because each community has different resources available in first response. They have different protocols that they utilize to get first responders out where they need to go and how to resolve a 911 call. And 988 is a new service. So gaining trust in the community, understanding that 988 is a resource for people in a mental health crisis is really important. But we're seeing even law enforcement vehicles and other public safety vehicles, we're seeing those vehicles advertise 988. So they're actually placing decals onto their vehicles to say, we are working with 988, and 988 might be an appropriate resource. Excuse me. So we see this in the crisis continuum. I have talked some about this. What we're seeing is that the crisis line can oftentimes resolve a mental health crisis, or the 988 line. We're also seeing that mobile crisis teams that respond as an appropriate response might keep the person from going to jail or an emergency room if that's not an appropriate outcome. So a mobile crisis team responding instead of a law enforcement officer might keep the person from getting charged or taken to the emergency room because there's no other option that the first responder has. So mobile crisis teams are an important part of the crisis continuum. So are those crisis facilities as well as wraparound care, all with the intended outcome of decreasing inappropriate use of jail, emergency department, and inpatient into a hospital for a mental health crisis. There are other ways to contact 988. So we have understood and taken into consideration, taken action on developing ways for other groups of people to contact 988s. In this case, specifically those who would communicate through American Sign Language or ASL. They can actually go to 988lifeline.org and start a video chat with a 988 center that also responds in ASL. So this is not an interpreter service. This is actually a national 988 center utilizing American Sign Language to provide help to that individual. Now, through the national network, if they need local resources, the national network can reach back out to an Ohio 988 center and get help. So pretty awesome here. We've also done a lot of work, and I don't have a slide here, so I'll just talk about it, to serve people with developmental disabilities. So providing training to 988 specialists on appropriate responses, communication styles that vary, sometimes just providing time and space for the message to be communicated, because sometimes the communication is different between people. So taking all of those things into consideration, as well as helping to raise awareness in special populations. So raising awareness in the deaf community, raising awareness in the developmental disability community, and raising awareness in communities that speak other languages than English. So many of those resources are available. I'm going to show you a link in just a few slides on where you can get those resources from. Now, in a live audience, I love to ask the question, how many people have seen an advertisement about Ohio 988? We have really tried to raise awareness. And we created a campaign with a marketing agency that has helped us with this. And the campaign really focuses on a couple of things. Number one, using a silhouette instead of pictures of real people, because it helped help seekers or potential help seekers see themselves in the campaign and not look at a picture of a real person and say, well, that doesn't look like me. I don't need 988. So really, we use a variety of silhouettes, but we chose a silhouette approach to this. We also chose the approach of just recognizing that when we are asked a question, as a general public, as humanity, we're asked the question, how are you doing? The most common responses are, I'm fine, I'm doing okay, living my best life. But then there's an asterisk that's behind it. Because if you were to stop and ask the person again, or go deeper, or have a connection to that person where they're truly comfortable with sharing honest feedback, they might actually be overwhelmed and they don't know how to ask for help. They might be having a really bad day. But in passing in the corridors of your workplace, or walking down the sidewalk of your neighborhood, and you ask that question, you're probably going to get the response, I'm fine. So if somebody is hiding how they really feel, we want them to know that 988 is a place that they can reach out to talk about what they're experiencing. So really, again, breaking the stigma and giving them a resource for how to reach out. We also then created a custom materials generator, and this is where everybody on this webinar can benefit from this resource. This custom materials generator allows you to create content to help raise awareness for 988. But the magic of this custom materials generator is that it comes from you. So it allows you to customize it from your organization, from your agency, from you personally, to show that it's you that is sharing this information, because you are going to be trusted in your circle of influence. Or if it was just coming from me, they don't know Doug Jackson, the 988 guy. They might not trust a state agency. But if it's coming from you, they know you, they trust you, and we want you to be able to raise awareness for 988. So I have another just short video, about a minute long, explaining the materials generator, and then I'll provide some ways that you can get in touch with this.
We can't do our work alone, so we built this online tool for everyone who shares our important mission. This materials generator empowers our partners to create their own materials that amplify our shared message and leverage our research and experience with the people we all need to reach. With the materials generator, you can access a library of content designed for specific audiences. You can select from available topics and find the types of materials that fit your needs. Then you can take that material and make it your own, selecting the images and messages that work best for your audience. You can even add your own logo and contact information. Then store all the materials you make on your own personal account. You can download, preview, and edit your materials at any time. Have a question or need help? Our help desk is just a click away. It's our way to help you help our shared audiences get the information they need. Professionally presented, guided by research and experience, and customized by you. This is your materials generator.
All right, you should now see a QR code on your screen, and you could actually take a picture of it. But these resources are going to be sent out as well. You could also Google 988 Ohio Toolkit. It's all going to take you to the same place. We have an extensive amount of resources. The videos that I've showed you today, both the custom materials generator, the one showcasing 988 specialist, as well as a whole host of other videos are on there now. We even did work with the Ohio Suicide Prevention Foundation to utilize people who have contacted 988 to share their story and help other people believe that if they contacted 988, that they would also get the benefits that these first party testimonials have shared. So those videos are on our website. They're downloadable. They can be reshared by you. They can be shown to audiences. If you're doing a presentation and you want to talk about 988, we want to provide all of the resources for you to do that and do that well. So this information is available to you. We want you to use it. We also have an email address that is specific to the Ohio Department of Mental Health and Addiction Services. Very big 988 team, that's 3 people. So I say that with some sarcasm. That's pretty easy for all 3 of us to monitor this inbox and make sure that it gets a response if you have a question. So feel free to jot that email address down, and if you've got additional questions and you want to get directly in touch with me or one of my teammates, feel free to send a question to that. So with that, we still have several minutes left as part of today's webinar. I'm going to pause. I'll put this up for just a moment as well, just to share information about the Ohio Department of Mental Health and Addiction Services. As I said, we are just days away, right on the brink of changing over to be known as the Ohio Department of Behavioral Health, for many very positive reasons making that change. But our social media will still be available. Our website will still be available and direct you to the right place. So leave that up there, and then I'm going to stop sharing so I can bring my face back up into full view with you. And open it up for conversation together with you.
Doug, while we're waiting for folks, could you share your screen again just so that we can get that 988 Ohio toolkit up?
Absolutely. Do you want the QR code one? Is that what you're referring to?
Yeah, just give folks a couple more minutes to pull that up if they're interested. And I'd also be curious, Doug, what do you think is something that the Ohio 988 system does really well whenever you compare it to other states? And also, could you click the hide button in the middle of your screen? I think that little toolbar at the bottom is perfect. Thank you. Yeah, so if you wouldn't mind letting us know what's something that Ohio 988 does better than maybe some of our other partners across the country.
I love that you're asking me to brag. Ohio has been a leader in 988 for the nation. We've been able to do that because of the support we've gained from Governor Mike DeWine, from the legislature, from all of our advocates. OSPF is a huge advocacy group for 988 in Ohio. Our stakeholders have been advocates. So we've really worked to make 988 a local response. Some states have chosen to have far fewer contact centers, as few as 1 contact center for the entire state. That's not the approach Ohio has taken. We've maintained spreading them out across the state to really be able to have the most local response possible. Funding is always a challenge. This was an unfunded federal mandate. So we are always, seeking the appropriate amount of funds to continue to support 988. That's not easy in tough budget cycles, but we've continued to make sure that 988 is a priority service for the state of Ohio, explain the return on investment into it. And we've achieved that by leading the nation by having that fast speed to answer rate. By having the connection with 911. That is unique in Ohio. A lot of other states are still working towards that. Ohio is leading in that. So our ability to interact when appropriate. Our workforce capacity. So you can't answer calls quickly. You can't provide the amount of time on a contact if you don't have the workforce. So working to build the workforce capacity to handle the volume as the volume has increased over time, that's been really important as well. Ohio is doing that well through the network of providers. So those are the first things that come to mind as a hopeful answer to your question.
We have some love in the chat from Matthew and Tracy. They really enjoyed the presentation, Doug. So the information was very helpful. I have a question about stigma. So we know that there's a lot of stigma around mental health in general and suicide. And we know Ohio is an especially rural state in a lot of places. So do you have any recommendations or strategies about how we can promote the helpline while also trying to reduce the stigma around seeking help, especially in some of those areas where it may be a little bit less common to reach out for support?
Yeah, I mean, there's a lot of ways to address stigma and really attacking it from the broad scale of the stigma of mental health. Of course, that is a tall order. It's a big task to undertake. When I look at it, I look at it from the stigma of what 988 is, what it can provide. So I look at helping people understand that 988 is not just for suicide and it's not just for other people, that it really is a resource for all people. I want to see people understand that calling 911 doesn't have a stigma to it, right? If you're having a heart attack, people don't think twice about calling 911. They're going to call and get help. If you have had a car accident, they're going to call 911 if there's injuries. No stigma attached. We want to really look at this in the very similar way as 911, that it is a 3-digit number to get help if you're experiencing a crisis. And what does that help look like and what is a crisis? I think that by educating people what the help is that 988 provides and that a crisis can happen to anybody, those are what help to reduce stigma and help make 988 normal for people to use. Great question.
Thank you. Feel free to drop any questions in the chat or in the Q&A, and I'll be happy to read them if you guys would like. Evie, do you have any other questions?
Yeah, I really liked the slide on the differences between 911 and 988. And I noticed such subtle changes in the wording around call 911 if you are threatening harm to self or others, but call 988 if you're talking about plans to harm self or others. And I fully understand the nuance needs to lie on a knife's edge there. I was curious if you've had concerns from folks that are worried about liability or folks not really understanding how to figure out when they should call which service regarding that specific issue. Do you have any advice for folks trying to split that hair?
That is a fantastic question because that's real. With 2 options of which number to call, they're going to run through the filters in their own head and try to determine which number is best. What we like to try to make people more at ease with is, because there is the ability for interoperability between 911 and 988, that there is not a wrong door. Now that's going to come over a lot of time and a lot of people experiencing an appropriate response. But the more times that 911 transfers to 988 because it doesn't need police, fire, and ambulance, and the more times that we do save lives because of 988 contacting 911, the more comfortable people are going to be that whichever number they call is an appropriate number. But we don't want people to not call because they're not sure which number. Call either one. We'll make sure that you get what you need. I think that's more the message that we should promote, and then back that up with the right actions that are able to occur after that.
We have a question in the chat from Tracy. She asked, you talked about decals on police cars about 988. What did they say on that decal?
Yeah, so that is that's a great question because it highlights that efforts like this are not just a state-driven effort. These are local communities having conversations about 988 being a resource for their community, meeting with leaders in their community that are part of the first responder resource, and really determining what's best. Because what we found is, if we just made one sticker and said to all law enforcement, all public safety vehicles, this is the sticker you have to use for 988, we probably wouldn't get buy-in. Partially just because the size of the sticker, the color of the sticker doesn't match what their, it's called striping package. You know, when you think of all the decals on an emergency vehicle, they have a theme to them, both in color and style, that matches what the community theme is. So we've said, we'll provide you with the language, imagery, things like that that you can draw from, but create it to be your own. So many times what first responders are putting on there is just something like 988 Suicide and Crisis Lifeline, as simple as that. Many first responder vehicles also have 911 on there. So side by side, it's showing that both numbers exist and that either number could be a resource depending on the circumstance. So we don't want 988 to go on a first responder vehicle if 911 is not on there, because then they might think that they're dialing 988 to get in touch with the first responder. We want them to be side by side or somewhere seen together on the vehicle so that they're seen as complementary to each other.
That's great. We also have a question from Chris. They asked, maybe I missed this, but can we reiterate the wait times? I know we said that Ohio had a better than average wait time. They also asked, are providers and schools sending this information out? In their experience, when they went through this with the doctors, they never mentioned 988, nor did the schools for kids that are struggling.
Yeah, a couple different things there. Let's go with the first one on the response time. So again, the calculation of the response time starts when the call is sent to a local contact center. So the time that it takes to listen through the message and select one or select two if you're choosing veteran supports or Spanish speaking, or wait on the line for it to go is only about 30 to 45 seconds, which I know is a long period of time, but we're also providing people with the best outcome to their call. So giving them options that if they need those specialized services, they can get them. 23 seconds is Ohio's average, as I said, even in August of 2025, 22 seconds of wait time before the call is answered. Wait time, just to put that in context, a telephone ring is about every 6 seconds, and then the ring takes 2 to 3 seconds worth of time on the ring before another ring then happens. So about every 9 seconds for a ring. So we're trying to answer the phone call between 2 to 3 rings is our goal. We don't want it to even get to a 4th ring before it's picked up. So that's our average speed to answer time. Nationally, it's higher. It's about 10 seconds, 12 seconds higher than ours. And then, okay, that was the first part of the question.
Yes.
I was just reflecting back. The second part of the question, will you remind me what that was?
Yes, absolutely. They asked, are providers and schools sending out this information? Because when they went through this situation, doctors had never mentioned 988 to them. And we also don't know if schools are sending this information out to the kids.
Yeah, great questions. I'm going to start with schools. That one's probably the easier one to answer. So Ohio did enact legislation that requires schools now. It's brand new. Really, this school year is when most schools have become compliant with it. It was enacted at the end of last school year, but it requires that all schools put 988 information on electronic portals that the students utilize. So that would be like portals that they sign into for homework and grades and things like that. So the student electronic portal, as well as if that school utilizes student IDs, that 988 is put on the student ID as well. We've been getting examples sent to us from all over the state of schools that have complied with that, believing that all schools are complying with that. That is through the Ohio Department of Education, working with their schools to make sure that that is happening throughout the state of Ohio in all schools. But the number of examples that we've seen and how schools have accomplished compliance has been overwhelming and positive. It's been great to see all the different examples. Personally, I'll share the story. We have a 16-year-old daughter, my wife and I. She is a high school student. And at the end of last school year, she was sending me text images of her school issued laptop. She was logged in through her student portal. And right there on her home screen was the 988 logo, link, and a description of what 988 can provide. So even from a personal perspective, I've seen that. Our daughter has seen it. She's called it out and was happy to show it to me. So schools are doing that. Medical facilities, not a current requirement that's in place. That would be a choice of a medical facility. We are gaining a lot of just voluntary willingness to use 988 as a resource that they highlight, especially on like discharge information, knowing that there's a lot of information that's giving at discharge. How do you make this stand out? How do you let people know that it's a resource that's available? We've seen it in a lot of correctional institutes as well with discharge. So just another place where somebody's life is significantly changing, going from being incarcerated to being released. Having 988 as part of the release packet that's there, as well as from mental health facilities as part of the follow-up or resource package that's sent out when the person is discharged. So those are not mandated places, but we are seeing a great amount of willingness to put it there.
That's great about the schools. Chris also shared that they have a Hope Squad in their daughter's school, but no one likes to use that service. So maybe 988 would be a better alternative for some of those kids.
Yeah, that is one of the magic features of 988 is the anonymity of it, and also that it can be done in private. So the confidentiality and even the location that allows privacy to happen. We have many students who contact 988 on the school bus to or from school, or used to be more so from school. There's been a lot of limitations of electronic devices in schools for good reasons, but that does limit some the ability to then connect to 988 during in-school. A lot of schools still have some allowances for the ability to check, like between classes or at lunchtime or something like that. So we are still getting texts from students who are actively in school during the day and sending, because they don't have to use their voice, sending a text. That text option is fantastic because not just for the scenario of school-based, but think about like being in a home situation that's not a safe situation. Maybe it's an abusive spouse or an abusive parent. Being able to reach out about the mental health trauma that's creating and how best to work through that, including, again, is a first responder needed?
Great. I think we probably have time for one or two more questions. I have another one I can ask while we wait. But Doug, I'm interested to hear if 988 has been contributing to if we've seen a decline in deaths by suicide in Ohio, or what those statistics have looked like, or if there's been any correlation, I guess, in those numbers since the program was initiated.
Yeah, so we have data that does show that, Ohio has recently seen about a 1% decrease in death by suicide. The contributing factors to that are probably multifaceted because there's been many approaches. It's not a controlled response to where we can limit it to just one single approach that has facilitated that improvement. I look at it from a personal perspective as well. So I get a lot of opportunity to interact with the public. Most recently at the Ohio State Fair. So the Ohio Department of Mental Health and Addiction Services had a booth there. Of course, we highlighted 988. We were trying to raise awareness by fair goers coming by the booth and interacting with us. But that's not the only place, but it's one place in a recent time that the words that I heard had the most impact on the work that I do. And those words were, "I'm alive today because of 988." Nothing more impactful than that if you are in the work of providing help to people, knowing that the help that you provided saved lives. So I know that doesn't answer the question with data or empirically, but it does answer the question that is there a correlation between 988 and lives being saved? I can confidently say that the answer is yes.
Thank you for sharing that example. That's incredibly powerful.
And a good way for us to wrap up. So I'll move into our end presentation notes. First, Doug, thank you again so much for helping us to understand more about Ohio's 988 Suicide and Crisis Lifeline. It's something that we're so incredibly proud and privileged to be able to support, and grateful to share this information with our audience. For our attendees, we'll be sending out an email to everyone shortly that will include today's slide presentation and the presenter's email address. And a reminder that if you'd like a prevention CE or certificate of attendance, please fill out the survey that will be available after this webinar. It should pop up automatically whenever you leave this webinar. You can also click on a link in the follow-up email. Finally, we hope that you'll join us on October 16th for our next presentation with Lynn Siegfried from the Mahoning County Board of Developmental Disabilities. Lynn will present on suicide prevention with individuals who have developmental disabilities, as well as the families, providers, and systems that surround these folks. Thank you all so much for joining us today, and hopefully we'll see you next time. All right.
Bye, everyone. Take care.